says, I'm Luke Tunnock from the University of Winchester. I'm going to be discussing the use of performance and image enhancing drugs as an alternative to seeking treatment with a GP. So just a bit of background before I start going into detail on this. Performance and image enhancing drugs historically have been associated with sporting performance in athletes, generally in the form of anabolic steroids, Olympic athletes, track and field and so on. But in recent years there's been quite an increase of use in the general population, just predominantly young men but also some young women training in gyms, often for image purposes, as noted there. So Bleeker notes a lot of it's for social media approval. Bates and McVeigh have noted that a lot of young men are training simply because they want to look a lot better. And what I sought to explore with my doctoral thesis, which is hopefully going to be published end of this year, was the cultural motivations and attitudes towards PIED use through an ethnographic lens, to try and see if use really was becoming normalised in the way that these quantitative studies suggest. And we were using the framework of Parker, Mishman and Aldridge in relation to recreational drugs and drugs more broadly to establish this with relation to performance enhancers. And in the course of ethnography, which does indeed suggest that use is becoming normalised, we also uncovered this pattern of health-oriented use or perceived health-oriented use, which is going to be the subject of my presentation today. So, as stated in the course of ethnography, there were several individuals who stated that one of their key motivations for using performance enhancers was that they felt it would improve their health in some way. And these individuals can really be split into two groups, which are sole purpose health users, people who specifically went out to use performance enhancers because they thought that it would improve their health, versus multiple purpose users who were generally sportsmen, in my study generally powerlifters because of the gyms I was conducting the ethnography in, and they tailored their use. They were using already for their sporting purposes, but tailored their use towards drugs that they perceived would give them some kind of health benefit as well. And it's worth just exploring the motivations of these individuals, because that's going to help inform any policy formulations that might come from this area. So in terms of multiple purpose users, the majority of individuals in the study who said they used for health as well as another purpose, it was generally sport, and it was usually to do with accounting for injury or wear and tear on the body as a result of the sport. So particularly with powerlifters, where the whole thing is they're lifting large amounts of weight, obviously causes some strain on the joints and the ligaments. So we have RL here noting that on top of the steroid cycle he took for strength purposes, he also took human growth hormone because he felt that would help repair his joints and allow him to keep training. And as you can see from his quote there, he's very much aware of the risks involved. He's weighed the risk and reward and said, how I feel now in terms of my joints is more important than a worry that human growth hormone might give me cancer in 20 years. So within the sport using population, there is definitely an awareness of the risks, but as well they make this analysis. And we saw it in terms of wrestlers as well, as I've noted with MF here, who said that a lot of wrestlers, because it's a constant on season, they have to train during the week, they have to do shows at the weekend, their money comes from being thrown around in a ring and hurting themselves. Obviously there's a lot of wear and tear on the body. A lot of wrestlers use opiates as a result of this, and a lot of them die from using opiates. And Chris Bell's done some very good work on this. But MF said he would prefer to use steroids and human growth hormones so that he has less pain and that he can repair faster, than to mask the pain using opiates, which is what a number of other wrestlers did. So in a way he's suggesting that by using these drugs he's improving his long-term health outcomes because it's taking him away from more harmful practices. And similarly, breakdancer MM noted that as breakdancers get older, obviously the cumulative effect on the joints of the dancing can cause some harm, can hurt their performance. So they sometimes use growth hormone for the exact same purpose. And I've just noted that in professional sports we have seen this with the example there of the UFC champion Anderson Silva, who used PIEDs to repair a broken leg and was caught doing that. And there is a question of whether this has trickled down from professional sports to amateur leagues. And Waddington's done a very good literature review on how that happened in terms of the strength gains. So I wouldn't be surprised if in terms of health it's followed the same pattern. So in terms of the sport-oriented individuals who begin using for health purposes, I think it's worth taking a look at their perceptions of the medical community. And they seem to quite correctly perceive that doctors would prefer to lessen the impacts of their training than to prescribe them with these drugs. But one of the issues here is, as Goldman notes, the kind of people who are high-level competitors, especially in these sports such as powerlifting and wrestling, are probably going to be far more driven to achieve in their sport than perhaps a rational consideration would allow for. So in his famous thought experiment, he asks if athletes would take a drug that would guarantee overwhelming success but would kill them in 5 years, and about half of athletes said that they would take that drug. So this is the mindset, and this shows why a prohibitionist stance from medical professionals might not help to actually move people off these drugs. So as noted, a lot of athletes don't see simply training less as an option. They feel as though they have to train at this very intense workload in order to compete, which is what many of them are most strongly motivated by. They're very focused, so they try to minimize the harms using performance enhancers instead of lessening the workload. So the suggestion here from myself is that perhaps seeking to educate and look at it from a harm reduction perspective is going to perhaps be more beneficial to us than trying to move these people off of taking these drugs. And Lee Moynihan suggested a similar thing in relation to bodybuilders back in '99, stating that because they would visit doctors who would say you can't use steroids because they are so harmful to health, the bodybuilders got the impression they actually knew better than the doctors, and then they would be less trusting of doctors more generally. And certainly from my ethnographic research, that pattern seems to be holding up today, although of course there's been an increase of use from these subcultures such as bodybuilding more broadly now. So if we just look at these sole purpose users, excuse me, people who use specifically for some health oriented goal, in the first instance we have people who are using as a shortcut, quote, to goals such as this client of gym owner SH, who her doctor told her she had to lose weight. She was 26 stone. He said it's not healthy. So what she did was go home, go on the internet and look up fat burners and ordered clenbuterol, which is a very powerful one, over the internet. And in this case, as noted, she specifically went on PIEDs because she wanted to follow her doctor's instruction and lose weight. And you can imagine the harmful effects of just going online and typing in fat burner and buying the first thing that comes up. And as SH notes, and I'm sure Joe will be able to inform us more on this later, on the internet it's apparently very, very easy to get hold of PIEDs. And as Evans Brown suggests, a lot of people are going onto these forums asking for medical advice and just taking whatever advice is offered, not verifying anything, and then just buying whatever is suggested. So this suggests a need for a broader public education than we had with the sport-oriented individuals who can be targeted in gyms specifically. This type of user, we can't really do that because it could be just anyone using a computer, so it needs to be addressed in a different manner. But there was another type of health-oriented use, which was fueled by persons who visited their doctor or visited a health professional and asked for some treatment for a condition and felt that they were denied health, as I've noted there. So I just want to address this group as well. RS, who had hypermobility syndrome, was prescribed opiates for her joint pain. Now, of course, opiates just mask the problem. They'll deal with the symptoms but not the condition. So she went online and looked for experimental treatments to actually help cure her condition, and found that there was some studies suggesting human growth hormone might help. So she went to her doctor and asked, is this something we can do? And you can see her response there. She obviously wasn't very happy when they told her, no, we're not going to put you in for one of these experimental treatments, you're just going to have to take the opiates. And paraphrasing it back, she knows how she was just dismissed out of hand, and they didn't really sit her down and explain to her why they wouldn't give her human growth hormone. There's no explanation of growth hormone isn't suitable because of this, or it is actually more harmful on balance. There was just no, we're not going to prescribe you with it. And that really seems to be what drove her to go to the black market and to buy human growth hormone, which she had shipped from a lab in China. She didn't receive an explanation of why she shouldn't use growth hormone. She was just told she wouldn't be prescribed it, so she took it upon herself, okay, well, if this might work, I'm just going to buy it. And of course, if you're ordering an underground product from a lab in China, it's far more likely to be dangerous. It could contain heavy metals, it might not be what it says on the label, and so on. So a lot more risk associated with this, and perhaps if her doctor had explained to her precisely why human growth hormone wasn't appropriate, she never would have got in this position where she's ordering online. And we saw a very similar case with JC, who had chronic fatigue, which he attributed to having low testosterone. So we can see his quote there. He's very frustrated that he can't just buy testosterone to try and treat himself, that he had to go to a doctor. But what seems interesting in terms of JC's going to the black market is we see this same pattern that we saw for RS, where his frustration really seems to be linked to his doctor not explaining why he wouldn't prescribe him testosterone, as opposed to just the refusal in and of itself. So he notes that in terms of the normal range, medically prescribed normal range, it's a very broad range, and that you could be medically normal but significantly below average. And he just wanted to see the numbers, because of course if he was at average or above average, he would know his problem wasn't low testosterone, so he would look elsewhere. But because it was never explained to him, he felt that he still had in his mind that it must be low testosterone, so he was looking to the black market. So again, a similar situation where because the doctor didn't explain to him why he wasn't being prescribed the treatment he had asked for, that encouraged him towards illicit drug use. Excuse me. So as I note, Harrison and Ahmad suggest that a lot of patients feel as though they've been stripped of their health autonomy when doctors don't fully explain to them why they have been denied treatment or why certain treatments might not work for them, and that this is probably something we need to look into if people are going to be using black market drugs, which could be very harmful, could contain contaminants. If we can encourage doctors to just explain why treatments are refused, maybe it will discourage that kind of use. On the subject of JC, because of course RS's condition is very rare, perhaps you might think it's not particularly going to be a public health issue. With JC discussing he thought he had low testosterone, this really seems to be something of a cultural meme. It's something that's cropping up quite a lot, the idea of low T being a serious risk and men needing testosterone replacement. So this is an advert I had come up on my Facebook, so I haven't gone out and purposely looked up adverts for this. This just happened to come up on my feed, showing low T, erectile dysfunction, don't let your masculinity suffer. So it's very targeted advertising. Clearly these people are aware of what to prey on to get young men to think they suffer this condition. Some of them probably do. I think we're going to see a large rise in men using testosterone because they think they have low T when really they don't, or when diet would be a better option to address. And it's come up in, for example, the Joe Rogan podcast, which has tens of millions of downloads every week. He discusses quite frequently low T and how you should get on testosterone if you have low T. So that's worth keeping in mind. It does seem to be a growing cultural phenomenon. And as noted, this might encourage something of a medicalization of society, and that's going to increase use more generally, lead to a broader normalization of this type of use, which, as noted, Evans Brown discussed in their research into online performance enhancers, and my thesis will detail. And it's also worth keeping in mind, as use becomes normalized for the purposes of image, just an increasing availability might drive people who otherwise wouldn't use them, especially in the case of fat burners, such as SH's client. If they have that increased access because it's more prevalent, because they'll know where to go and get it, it might encourage more people to use it. And similarly with CrossFit and this workout culture, if people are determined to keep up with these WODs, workout of the day, and it's causing them injuries, they might say, well, maybe I need to get on human growth hormone. So just to summarize those three policy suggestions that I had, one is a targeted campaign for sport-oriented individuals in gyms. Another is encouraging doctors to explain treatment decisions so that we can avoid this problem of them looking to black market solutions. And finally, public information campaigns to target the individuals who are going to these online forums and looking for advice. That's my presentation. Thank you very much.